Okay, let's dive in. Imagine a medical treatment where you're placed inside like a sealed chamber, the pressure around you increases, and you breathe pure oxygen. It sounds kind of futuristic, doesn't it? Maybe a little intense.
It definitely captures the imagination.
Yeah.
And it's a real and actually quite powerful medical therapy called hyperbaric oxygen therapy.
Hyperbaric oxygen therapy. Okay.
Sometimes you'll see it written as HBO2, but yeah, let's just stick with the full name for clarity today
Yeah.
as we, unpack it.
Good idea. And to really understand what it is, and maybe even more importantly, what it isn't, we're going straight to, well, the definitive source.
You are.
We're doing a deep dive into the 15th edition of the Hyperbaric Medicine Indications Manual. That's from the Undersea and Hyperbaric Medical Society.
Exactly. And this manual, it's essentially the roadmap. It's created by the leading experts in the field. So our goal today is really to walk you through it, figure out what makes a legitimate hyperbaric oxygen treatment and what you absolutely need to know if, you or maybe someone you care about might encounter this kind of therapy.
Think of this deep dive as getting the essential guide, like straight from the experts, helping you cut through any confusion out there. This is for you, whether you're just curious, maybe exploring options as a patient, or, supporting someone through their medical journey.
It's interesting, too, because while the treatment feels very modern, the actual idea of using pressure to affect the body, yeah, it goes way, way back.
Really? How far back?
Even to the 1600s. Some early thinkers were speculating about how air pressure might influence health.
Wow. Okay. I wouldn't have guessed that. And I suppose things developed from there.
Yeah, slowly. You had people exploring pressure changes, maybe for divers, even building some early pressurized rooms back in the 1700s, 1800s. But the modern clinical application we're really talking about today, that took shape much later. And it was significantly influenced by undersea medicine.
Ah, the diving connection.
Exactly. The organization that became the Undersea and Hyperbaric Medical Society, the UHMS, it was founded in 1967. It started out focused on diving, understanding how pressure affects the human body underwater.
Makes sense.
But they quickly realized that those same principles could apply to helping people with specific medical conditions, not just divers suffering from decompression sickness.
So the focus kind of shifted, or expanded maybe, from just dealing with the effects of being in pressure to actively using pressure as a treatment. That seems like a really crucial shift.
It was a major expansion. And this manual we're looking at, it's not just one person's opinion, right?
Well, definitely not. You mentioned the UHMS.
Well, the UHMS established a committee way back in the 1970s, and it was made up of experts from many, many different medical fields.
Like who?
Oh, surgeons, emergency doctors, specialists in diving medicine, wound care folks, cancer treatment specialists, infectious disease experts, anesthesiology, really a whole range of people.
Wow, so it's truly a multidisciplinary effort.
Precisely. And this manual is the result of decades of that diverse group rigorously reviewing scientific evidence.
Okay, so they're looking at clinical studies, research.
Extensive experience from recognized centers, all to determine which conditions hyperbaric oxygen therapy is genuinely effective for. This 15th edition, it just reflects that ongoing evidence-based process.
Okay, so armed with this expert perspective, let's get to the heart of it. What is clinical hyperbaric oxygen therapy, according to the UHMS manual? Because as you said, and the manual points out, this definition seems key and it's often misunderstood.
Yeah, this is where we need to be really, really clear. According to the experts, it's a medical procedure, first and foremost.
Medical procedure, meaning?
Meaning it requires a physician's prescription.
Yeah.
And it has to be administered under medical supervision. It's definitely not a walk-in spa treatment or something like that.
Okay, so a doctor has to decide you need it, and medical staff have to be involved in actually giving it to you. Got it. What else defines it?
The entire body is pressurized, not just a limb or part of the body, your whole body.
The whole body. Inside what?
Inside a specifically designed, hard-sided chamber. And critically, this chamber has to meet really rigorous safety standards.
Like building codes.
Sort of, but for medical devices.
Yeah.
We're talking standards set by organizations like the American Society of Mechanical Engineers or the National Fire Protection Association. These are not just, casual enclosures. They're built for safety under pressure.
Hard-sided and meeting strict safety codes. Okay, that sounds incredibly important just from a safety perspective alone. What about the pressure level? Does that matter? How much pressure are we talking?
It absolutely matters, yes. This is a core defining feature. For a treatment to be considered standard hyperbaric oxygen therapy by the UHMS, the pressure used is typically not less than 2.0 atmospheres absolute.
Atmospheres absolute, ATA. Okay, can you help us visualize that? What does 2.0 ATA feel like?
Well, think of it this way. 1 atmosphere absolute, or 1 ATA, that's the air pressure you're experiencing right now, more or less at sea level.
Oh.
So 2.0 ATA is twice that pressure. It's like being about 33 feet underwater in terms of pressure.
Oh, okay. That's significant.
It is. And clinical treatments usually range between 2.0 and 3.0 APA. This increased pressure, it's fundamental to how the therapy actually works at a physiological level.
So it's significant pressure, definitely not just a little bit more than we feel right now. And the oxygen. Are you just breathing regular air inside this pressurized chamber?
No, and this is the other crucial element. You breathe medical-grade oxygen.
Medical grade.
Which means it has to be at least 99.0% pure oxygen. Under that increased pressure we just talked about, breathing this really high concentration of oxygen allows your body to absorb far, far more oxygen than it could at normal atmospheric pressure.
So the pressure helps the oxygen get into your system.
Exactly. It dissolves much more oxygen into your blood plasma. It's like delivering a powerful drug systemically, meaning throughout your entire body. And the Food and Drug Administration, the FDA, actually regulates this medical oxygen for the specific medical uses listed in the manual.
Okay, so it's pure oxygen delivered throughout the body under significant pressure. How long does a typical treatment last? Is it quick?
Not really quick, no. A single session usually lasts somewhere between 90 and 120 minutes.
90 minutes to 2 hours. Okay.
And it's rarely just a one-off treatment.
Yeah.
For most conditions the UHMS accepts, it involves a whole series of treatments, often delivered daily, maybe 5 days a week over several weeks.
Like how many weeks?
Typically 4 to 8 weeks is common, though, emergency situations might require more frequent sessions, especially right at the beginning.
All right, so let me see if I can summarize the UHMS definition based on what you've said. It's a medical procedure, needs a doctor's oversight. Your whole body is pressurized to at least 2.0 atmospheres absolute. This happens in a safe, certified, hard-sided chamber. And while you're in there, you breathe pure medical-grade oxygen for about 90 to 120 minutes per session. And it's usually part of a series of treatments over weeks.
That's an excellent summary.
Yeah.
Exactly. And just as vital as knowing what it is understanding what it isn't.
Right, because you mentioned confusion.
Yes, this distinction is particularly important given the variety of facilities and treatments being marketed out there, sometimes using similar terms.
And this seems where it gets really critical for anyone listening, whether you're considering this therapy or you're a caregiver trying to evaluate options. What are the key things the UHMS manual says hyperbaric oxygen therapy is not?
Okay, first big one. It is not just applying oxygen topically, like directly onto a wound.
So putting an oxygen mask near a cut or something?
Or maybe a bag around a limb with oxygen pumped in. While topical oxygen might have some limited uses perhaps, pressurizing only a small part of the body or applying oxygen without that significant whole body pressure, it just doesn't meet the definition of systemic hyperbaric oxygen therapy. Your entire body needs to be in that pressurized environment breathing the oxygen.
Okay, so local oxygen delivery isn't the same as this whole body systemic treatment. Got it.
Correct. Second point. Treatments delivered at what are called mild pressures, meaning less than the 2.0 atmospheres absolute threshold we discussed, are explicitly stated by the UHMS as being distinct from standard hyperbaric oxygen therapy.
So if you hear about treatments at, say, 1.3 or 1.5 atmospheres absolute, that's different.
That is not the same medical therapy as defined by the experts in this manual, yes.
Why is that distinction so important?
Because the physiological effects achieved at those lower pressures are different. And according to the UHMS manual, they're just not sufficient for the accepted medical indications where standard hyperbaric oxygen therapy has been proven effective.
Okay, so pressure level is critical. What else is not HbO2?
And third, just being pressurized with air, normal air, even if maybe you're breathing slightly enriched oxygen through a mask or something, that's also not considered standard hyperbaric oxygen therapy if you're not breathing near 100% oxygen under the required pressure level. It's the combination of high pressure and high purity oxygen that delivers the therapeutic dose systemically.
Okay, this combination is key. This brings us directly then to the issue of what are often called mild hyperbaric facilities, or maybe mild hyperbaric oxygen therapy.
Mm.
You sometimes see these marketed maybe in wellness centers, spas, even shopping centers, often using those soft-sided, inflatable-looking chambers.
Yes, exactly those. And the UHMS manual is very, very direct about these setups. These facilities typically operate at those lower mild pressures we just talked about, usually well below the 2.0 atmospheres, absolute standard required for the UHMS definition.
And what does the UHMS manual say about the scientific evidence for the treatments offered in these types of settings?
It states very clearly, and this is a direct point from the manual, that there is no credible scientific evidence listed within their manual to support the use of mild hyperbaric oxygen for the vast majority of conditions often treated in these non-medical facilities.
No credible scientific evidence. That's a pretty powerful statement, especially coming from the leading authority based on decades of review.
It is.
So what does that mean for someone who might be thinking about seeking treatment there?
Well, it means that for conditions like uh, autism, cerebral palsy, certain types of traumatic brain injury or post-concussive syndromes, stroke recovery, near-drowning outcomes, maybe cognitive decline conditions often targeted by these mild hyperbaric centers, the UHMS manual, which represents the consensus of leading experts looking at the actual evidence, does not support using mild hyperbaric oxygen for those conditions.
So someone might be seeking help for a really serious condition based on claims that just aren't backed by the scientific evidence compiled by the UHMS experts.
Exactly. And it actually goes beyond just a lack of evidence for effectiveness. There are potentially significant safety risks associated with some of these setups, too.
Safety risks. Okay, tell us more about that. That sounds concerning.
A major concern is fire, a huge concern. Many of these mild hyperbaric systems use oxygen concentrators, which pull oxygen from the air. If there are leaks in the system or maybe around the chamber seals, the oxygen level in the surrounding room air can quickly rise to dangerous levels.
Higher oxygen in the room air itself.
Yes. And in an oxygen-rich environment, even just a little bit above the normal 21% oxygen in air, a small spark, maybe from static electricity, faulty wiring, even friction, it can instantly become a flash fire, or potentially even an explosion.
Wow. That's terrifying imagery. A small mistake, a tiny spark, could lead to a huge fire risk.
It's a very real danger, unfortunately. Medical-grade hyperbaric chambers, the hard-sided ones we talked about, are designed with incredibly stringent fire safety protocols, precisely because of the inherent risks of handling pure oxygen under pressure. Many of these mild hyperbaric chambers and their oxygen delivery systems simply do not meet these necessary medical safety standards.
So they might not be built to the same safety requirements.
They often aren't, no. And there's also a risk, though perhaps less common, of serious injury or even death from what's called explosive decompression if the chamber itself were to fail structurally under pressure.
Okay, so potentially ineffective for many of the conditions they claim to treat, and potentially very dangerous because they often don't meet medical safety standards or the regulatory requirements for medical devices.
That's really the critical takeaway, yes. The UHMS manual also highlights something else important here. Even if someone does have a condition that is an accepted indication for standard hyperbaric oxygen therapy.
Like one of the conditions actually listed in the manual.
Right. Receiving treatment for that condition at a mild hyperbaric center, one operating at lower pressures, or with inadequate oxygen delivery, could actually lead to severe harm or even death. Why? Because the treatment being delivered is simply not the medically defined therapy that has been shown to be effective. You're getting an inadequate dose, essentially.
So you think you're getting treatment, but it's not the right dose or pressure to actually work, and that delay or inadequate treatment could be harmful.
Precisely. The manual explicitly warns against healthcare advertising practices that promote these unproven uses or mislead patients about what they're actually receiving.
It really sounds like understanding this UHMS definition, the pressure, the oxygen, the chamber type, the medical setting, and knowing where treatment is delivered is absolutely vital for your health and your safety.
It truly is. Now, just briefly, in those medical facilities that do provide standard hyperbaric oxygen therapy meeting all these criteria, there are typically a couple of different types of chambers used.
Okay, let's quickly touch on those just so people know what they might see in a proper medical setting.
Right. So in the manual, these medical chambers are primarily categorized as Class 1 and Class 2. Class 1 chambers are what we call multi-place chambers,
Please.
meaning they're larger rooms or maybe big tubes that can hold several people at once, patients, and usually medical staff attending them inside the chamber.
Okay, how does the oxygen work there?
In a Class 1 chamber, The entire chamber is pressurized with compressed air, just regular air, and the patients inside then breathe the pure medical-grade oxygen through tightly fitting masks or sometimes clear plastic hoods.
Okay, so multiple people, the room itself is pressurized with air, but the patients get pure oxygen through a mask or hood.
Got it. Exactly. Then there are Class 2 chambers, which are monoplace chambers.
Mono meaning one.
Yes, these are designed for just a single patient at a time. They often look like a large clear tube that the patient lies down in. In this type of chamber, the entire chamber environment is pressurized directly with 100% medical oxygen.
Ah, okay. So a single person, and the whole chamber is filled with pure oxygen under pressure.
That's right. And the UHMS definition clarifies that both Class 1 and Class 2 chambers, when they're located in proper medical facilities, meet all the required safety standards and are operated correctly by trained staff. Both can deliver effective hyperbaric oxygen therapy as defined by the manual.
Good to know. So both are legitimate ways to get the therapy.
Correct. The manual also mentions Class 3 chambers, but those are just for animal use, so not relevant for human treatment. And it reiterates that just delivering, say, near 100% oxygen at normal sea level pressure, 1 atmosphere absolute, or only pressurizing a body part, that doesn't count as hyperbaric oxygen therapy. Pressurization generally needs to be 1.4 atmospheres absolute or higher, with the whole body pressurized to even start approaching the definition threshold. But remember, standard therapy is typically 2.0 atmospheres absolute or higher for the accepted conditions.
Okay, so Class 1 and Class 2, in proper medical settings, delivering at least 2.0 ATA with pure oxygen. That's what the experts are talking about.
Yes. And, you might be wondering, how does the UHMS actually decide which conditions make it into their manual as accepted indications for this very specific therapy?
Yeah, that process must be really key to why this manual is considered the sort of gold standard, especially given what you said about the lack of evidence for treatments offered elsewhere.
It absolutely is. The UHMS Hyperbaric Medicine Committee, the group that writes the manual, they have a really rigorous process. They're continuously reviewing all the new research that comes out, all the clinical data.
So they're always updating it.
Constantly evaluating. And for a condition to be accepted into the manual, it requires strong, compelling scientific evidence.
What kind of evidence counts as strong enough? What are they looking for?
Well, they look for several things. First, a sound scientific rationale, like does it make sense biologically how the therapy would help this condition? Then they need strong evidence from laboratory studies. And most importantly, they need well-designed, controlled clinical studies in humans, plus extensive positive clinical experience reported from established, reputable hyperbaric centers. It's actually a very high bar to clear.
So it's not just a hunch or a few anecdotes. It has to be backed by proper science and proven clinical success across multiple centers.
Precisely. And if someone proposes a new condition, say a researcher thinks it might work for something else, there's a formal process. The evidence gets submitted, it's reviewed by subcommittees of experts in that area, it's presented to the full committee, often debated quite extensively.
I bet.
And ultimately, it's voted on by the UHMS leadership. So it's a very methodical, very evidence-based path designed purely to ensure that only conditions with really convincing scientific backing are listed in the manual as recommended indications.
And that list has changed over time, hasn't it? I think I saw in the outline that historically there were maybe more conditions recommended for reimbursement, and that number has been refined down to 15 in this current edition, based on where the evidence is strongest now.
That's a crucial point, yeah. It shows this isn't some static list carved in stone decades ago. It's continuously updated as the science evolves. If the evidence for a condition becomes less convincing over time, based on new studies, it can be removed from the recommended list. And conversely, if new, strong evidence emerges for a condition, it might be added after going through that rigorous review process.
That makes a lot of sense. It's like a living document, always reflecting the current state of the best available evidence-based medicine in this field. Okay, so finally, if someone listening does have one of those accepted conditions, one of the 15 listed in the manual, and they're seeking this legitimate therapy, what does the manual or the UHMS guidance say about finding qualified care? How do you make sure you're in the right place?
This is maybe the most critical actionable point for you as a listener if you're in that situation. The manual emphasizes really strongly the absolute importance of being evaluated for and then supervised during hyperbaric oxygen therapy by physicians who are specifically qualified in undersea and hyperbaric medicine.
So not just any doctor can prescribe and oversee this.
That's right. You ideally want physicians who have undergone specific training and have gained certified expertise in this specialized field. The manual also stresses that the operational staff, the nurses, the technicians, or other personnel who actually run the chambers and monitor you during treatment, they must also be properly trained and ideally certified by recognized organizations like the UHMS itself.
Okay, so look for a doctor with specific qualifications or board certification in hyperbaric medicine, and ensure the staff running the equipment are also properly trained and certified. Are there other ways to know if a facility is legitimate and meets standards?
Yes, absolutely. The UHMS actually has an accreditation council, and this council runs a program that accredits hyperbaric facilities based on meeting established standards for safety, for staffing qualifications, equipment maintenance, quality assurance protocols, things like that.
Ah, so there's an accreditation.
Yes. Seeking care at a UHMS-accredited facility is an excellent way to help ensure you're getting the proper, evidence-based treatment in a safe, well-managed environment.
That's incredibly helpful guidance. So physician qualifications, trained staff, and ideally UHMS facility accreditation. Those are key things to look for.
Exactly. It's all about ensuring the treatment is delivered correctly, safely, and importantly, for a condition where there's solid evidence that it's actually going to help. The manual even provides general guidance on the typical number of treatments needed for the accepted conditions. And it notes that significantly exceeding these numbers usually requires consultation with another qualified hyperbaric physician, again, highlighting that focus on appropriate evidence-based care, not just endless treatments.
Right, makes sense.
Yeah.
So wrapping this all up then, what's the absolute key takeaway? If there's one thing people should remember from this deep dive into the expert's manual, what is it?
I think the core message is loud and clear. Not all treatments out there that use the word hyperbaric are the same thing, not even close in many cases. Proper medical hyperbaric oxygen therapy, as defined by the leading experts at the UHMS based on decades of scientific evidence, is a very specific medical procedure.
And that specific procedure involves?
It requires particular pressures, typically not less than 2.0 atmospheres absolute. It requires breathing pure medical-grade oxygen. It requires delivery in certified, hard-sided medical chambers that meet stringent safety standards, and it absolutely requires oversight by physicians and staff who are specifically qualified and trained in hyperbaric medicine.
And just as importantly, on the other hand,
treatments often marketed as mild hyperbaric, frequently found in non-medical settings like wellness centers, often using lower pressures, maybe soft-sided chambers or different oxygen setups. These explicitly lack credible scientific evidence in the UHMS manual for most of the conditions they're used for.
and they can carry risks.
And critically, yes, they can pose significant safety risks, like fire or decompression hazards, often because they may not adhere to the necessary medical safety and regulatory standards required for this kind of therapy.
Understanding that difference, that distinction, sounds absolutely vital for your health and your safety if you're ever exploring this area.
It really is. It's how you can differentiate between a legitimate, evidence-based medical therapy delivered by qualified professionals and other practices that might be unproven, ineffective for your condition, or potentially even dangerous.
Okay, so that brings us to our final thought for you, the listener. Given this really stark contrast we've discussed between a specific medical therapy backed by rigorous evidence and expert consensus, and these other practices that lack that evidence base and carry significant risks, what questions does this raise for you about how you evaluate any kind of emerging or maybe alternative therapy you might encounter?
Yeah, if we kind of connect this to the bigger picture, this deep dive into hyperbaric medicine really underscores the importance of asking some fundamental questions, doesn't it? Like, what is the actual scientific evidence supporting this treatment? Who are the experts saying it works, and what is their process for deciding that? Is it rigorous? Is it transparent? And crucially, is the treatment being delivered in a setting that meets recognized medical safety standards by appropriately qualified and trained professionals?
Those seem like essential questions to ask, not just for hyperbaric therapy, but really anytime you're considering any medical intervention, especially one that might sound new or different.
Absolutely. Asking those questions helps you become a more informed partner in your own healthcare.